that. Thank you very much for the very kind introduction, and thank you for bearing with us. It's truly a long day, but hopefully what I will be speaking about will be informative. As Norm said, I represent NicoPure Labs. I've joined them recently as General Counsel and Chief Compliance Officer. I'm an attorney. And today's presentation is supposed to focus on strictly the federal regulation that we're facing. I'm so sorry. Oh, it's all right. So the previous speakers have, of course, very kindly touched on a number of issues. Of course, the gentleman from the vaping militia talked a little bit about state laws, about engagement, consumers, regulators, and the other speaker talked a little bit about manufacturing facilities, clean rooms, and so on. My focus is more narrow, and it is more narrow because it is my area of expertise, which is Food and Drug Administration law. During my career, I actually have had the opportunity and privilege not only to interact directly very often with the Food and Drug Administration, but also to take some products through the approval process. That is the same approval process that vaping products will eventually have to go through in the near future. So today, I would just share a few thoughts about the company I represent, NicoPure, for those of you who are not familiar with it, and a little bit about our products, but that's not really the focus. The focus is the upcoming Food and Drug Administration regulation of tobacco products, of vaping products as tobacco products, and what will happen next, and why is 2016 a very important year for all of us. And I would like you to walk away after this presentation feeling that at least you know where to look, and at least you know what will happen the day after the deeming rule, meaning this regulation of the Food and Drug Administration, will be adopted. I want you to basically sleep better at night, if you wish, knowing these little things that I will share with you today. So a little bit about NicoPure. I joined NicoPure because they persuaded me that they're a responsible manufacturer, committed to compliance, committed to surviving and being sustainable in the wake of changing regulation, both in the US and internationally. This is a company that has been around for almost 7 years now, and that basically sells product domestically, but has also a sizable business overseas. And as Chief Compliance Officer, it's very easy for me to tell you and confirm that it's extremely difficult to comply with regulations from different countries when you make one product in one manufacturing facility. There is labeling issues, there is different legal requirements in different countries, and it's very, very complex to navigate that. Our commitment to quality is really reflected by the investments the company has made into its manufacturing facility. It's in Gainesville, Florida. And really, we are trying to stay ahead of all of the regulatory and standard developments that were mentioned by the previous speakers, and we're also trying to, more importantly, anticipate and influence those changes and shape them with a view to actually ensure that we're given everybody an opportunity to compete. I think competition is a good thing. I think there is a very narrow view where people say, well, let's draft this kind of regulation or that kind of regulation. It'll keep our competitors out of the market. That's not our goal. Our goal is to accomplish sustainable regulation that can be complied with at a reasonable cost, that is proportional to the harm reduction potential of these wonderful products that are the vaping products. This is the goal. Whether we like the outcome, we have to be aware that regulation and compliance comes at a cost. It comes at a cost to the banking industry, to the automotive industry, to every industry. Basically, every new law has a cost. And ideally, it should be a one-off cost, and after that, we should be able to go about our business. The reason we've tried to be ahead of regulation is anticipating, with our products, with our child-resistant caps and so on, is because we are an industry that is novel, but at the same time, as a consumer industry, as an industry that sells ultimately a product based on nicotine, it's not all that new. Consumer products, inhaled products, nicotine-containing products, as much as we don't like to be associated with them, have been on the market for a very long time. Some by the pharmas and some by the tobacco company, but the fact of the matter is nicotine has been around for a very long time. So for us to say, well, we don't really know what is expected of us, it's a little bit disingenuous. So, very quickly, our company, again, has invested a lot, as others have, of course, I'm sure, in research and development and in compliance. And I'm just mentioning here very briefly some of our most favorite flavors. But for us to be able to bring and keep these flavors on the market, we really need to know what will happen in the near future. And the most crucial thing, or the most crucial two things that are going to happen in 2016 are state-level developments, which I will not address today because of an interest of time. We just don't have time for that. And federal-level developments. And as much as I agree with all of you that regulation is an onerous thing and possibly a bad thing, regulation is also, to some extent, a good thing, especially federal level. And I'll tell you why. We may not like what it's going to look like, but if we're not regulated at federal level, we're going to have to comply to 50 different laws at state level. And every state is going to tell us how to make our product, and every state is going to tell us to make our product in a different way. So how would that work exactly? I don't know, because if you only have one manufacturing facility, you cannot make your product 50 different ways. Or maybe you can, but just imagine the cost. There is a vacuum, a regulatory vacuum right now. Everybody is sort of on the sidelines. The states have been moving and been a little faster. The FDA is going to move in the immediate future. So what I'm going to talk about right now, and with the hope that it'll give a little bit more clarity, is exactly what will happen with the deeming rule and what the deeming rule says. And you've heard today said that we don't know what FDA's deeming rule says, and I disagree. We know what the FDA deeming rule says. It's been published a year ago in April. It's not going to change much. If you think it's going to change much, think again. FDA is very limited by the provisions of the Tobacco Control Act in the manner it can regulate electronic cigarettes. Whether we like it or not, that is the truth. So if you read the Tobacco Control Act, everywhere there is a reference to tobacco product, you can substitute to those two words the words e-cigarettes or e-liquids or vaping devices, because that's exactly the requirements that are going to be applicable to this industry. And the deeming rule, what it really does say, it says, from now on, thou shalt be tobacco product. That's all the deeming rule is going to say. It may say a few other things. It may say you cannot sell to under 18, you cannot sample, a few other things. But the main role of this deeming rule is to deem new products tobacco products. And that's all it has to say. Thou shalt be tobacco product, and go and read the Tobacco Control Act, and then you'll know what you have to comply to. And that act has been on the books since 2009. It's been signed into law. It's everybody, can look up the FDA website and read it. And some of us that have been around, since, that time in the industry obviously know exactly what those requirements are. So truly, it's not that difficult. In order for you to prepare, there is the following thinking process that we all have to engage in. We have to acknowledge that we disagree with the fact, with the regulatory outcome, that e-cigarettes and vaping products will be regulated the same way like tobacco products. We don't like that. And the fact of the matter is, there probably are going to be legal challenges. When the deeming rule comes out, there probably will be people suing the FDA, which is fine, perfectly fine. Well, you have to also take into consideration the 50-50% chance that that lawsuit is not going to be successful. I wish them luck, whoever they will be, or whoever we will be, it doesn't matter. It's just We have to take into consideration that lawsuits move at a certain pace, and within 6 months or a year, if that particular lawsuit is unsuccessful in appeal and so on, then you will have to go back to the drawing board and comply to what the Tobacco Control Act says. And I don't know about you, but if I had, all of my life savings, such as most of you do have in this business, and if I went to a casino and if I said, okay, it's red or black, what do you put your money on? I feel very nervous to know that there is a 50% 1 in 2 chance basically that I will lose all my life savings because I'm basically not preparing for the other outcome, right? It also, it's unreasonable to expect that the product will never be regulated because, let's face it, our stakeholders who are the public, the consumers, the public health community, to some extent even ourselves, we want some form of regulation. We want product standards. You've heard that from everybody. This is a good thing. But we cannot write our own standards. We can, but legally they're not enforceable. So there's got to be a regulator that writes them. So whether it's the FDA or Congress intervenes at a later date or some such, but eventually this industry will be regulated, and that is imminent because of the public perception, all of the things that you've heard before. So let's go a little bit through the details of what the Tobacco Control Act says that we have to do a month or a day or however long after the deeming rule is adopted. The reason we can be regulated as a tobacco product is because the Tobacco Control Act defines tobacco products as anything made or derived from tobacco. And I agree with you 100% that the nexus between e-cigarettes or e-liquids and the tobacco plant is very, very remote. Because, nicotine is derived from tobacco. And I also agree with you that with the advent of synthetic nicotine or nicotine derived from other plants, there's going to be a parallel line of products that are not going to fall under the Tobacco Control Act. And we'll see what FDA will do with them. I write blogs, I write articles, I invite you to read them because I'm trying to provide some insight into those regulatory schemes. But the fact of the matter is, the Tobacco Control Act today allows the FDA to bring all products with tobacco-derived nicotine under the Tobacco Control Act. Because in 2009, when the law was adopted, the law said, now in 2009 we're going to regulate these 4 types of tobacco products: cigarettes, cigarettes tobacco, roll your own tobacco, smokeless tobacco. And they have been regulated since 2009, and all tobacco manufacturers and importers had to comply with a number of requirements, very onerous requirements, of which the most onerous is the pre-market approval of any change to the product by the Food and Drug Administration. And let me tell you, having been through that process, the Food and Drug Administration doesn't grant those pre-market approvals easily. That's the understatement of the year, actually. It's extremely onerous. You have to sweat blood pretty much to get an approval. Been there, done that. So, what happens in April 2014? Again, the deeming rule was issued, and the deeming rule said basically 2 things. The following products, including e-cigarettes and liquids, are going to be regulated, and a couple of other requirements that were applicable. We all had an opportunity to submit comments. That's what happened. The comment period closed, and FDA has confirmed that it has reviewed these comments, and we know it has prepared a final rule. Now, because of the way the administrative process works, FDA cannot write a new rule that is very different than the rule it published, or I should say the proposed rule it published in 2014. That's not how it works. If they change it a lot, then they have to open again. In principle, they would have to open again a comment period and drag it on for another year. And FDA is under a lot of pressure, from Congress, attorney generals, the public health advocates, to do something and to regulate this industry. So it's very unlikely that FDA would take the risk to issue a final rule that is any different or very different than what we saw in 2014. Now, the final rule, as you've heard before, goes to the Office of Management and Budget, which is a part of the White House. Now, there is a website that you can all look up, OMB website, OIRA, and you can look it up, and there it says what rules and proposed rules OMB is looking at to assess the economic impact. Now, OMB won't change the text of the rule, but if for some reason it thinks the rule is not, implementable, or it has a disproportionate economic impact, it may tell FDA that they have to go back and do something else, right? I don't think that's going to happen in this case, by the way. Also because OMB has seen the draft deeming rule last year, and all of us, including myself and many others, have met. So pretty much the issues are the same. They were the same last year that they would be this year, so it's not likely OMB will act much. But if you look at the OMB website, it'll say when this final deeming rule is under review. And while you don't need to be a lawyer to do that, it's public information. Many of the advocacy organizations will let you know when OMB is reviewing. CASA will let you know, Vaping Militia, myself, if you read the blogs, because that's going to be on the website. OMB can review it for a number of weeks, usually up to 3 months, but they can be very fast. So if we look at the timeline, today, that rule, to my knowledge, I haven't checked this morning, but I'm assuming it's still not at OMB. If it were to get to OMB on Monday, theoretically we could have a month or 3 months, or maybe even more, until the final rule is published. And I agree here that December could be an option, maybe January for a final rule. It's definitely not going to be in the next month, because OMB has to, look at it a little bit, even if they don't use up all the 3 months that they have. And then the final rule will be published in the Federal Register, and it's usually a 30-day implementation period, we'll see, but generally it becomes effective in 30 days. Now, of course, legal challenges can be filed. So in other words, people can sue the FDA, whether for parts of that rule, sections of that rule, or for the entire rule. And I bet many people will. And that can delay the implementation of the rule, although not necessarily so, but it can. And it's a likelihood that it will, because my personal speculation, not knowing anything very concretely, is that there's going to be at least several lawsuits of different sorts. But whether a lawsuit is successful or not, whether people sue, again, as I was mentioning before, that's not something you can count on very much, because there is a clear understanding that we will be regulated. So assuming either nobody sues the FDA, or that those lawsuits are not successful, or in fact there is another option, assuming that the people who choose to challenge the FDA challenge just portions of the rule but not the entire rule, what do we have to comply with within a relatively short period of time after the rule's implementation? FDA will tell us by when we have to comply with all of these things. So if you look at this list, and I'm sorry, I know it's not visible, if you want to move to the left, or in any event, I'll make this presentation available. But there is a number of things that tobacco companies already comply with, and they're not, except for one, they're not impossible. So the first thing, FDA wants to know who makes and imports electronic cigarettes. And there is a form that we'll have to fill up to basically register our manufacturing facilities, tell the FDA, I'm a manufacturer that operates in the US, or an importer. And that's a simple thing. You tell them your address, the name of the responsible parties, whatever. That's the simplest requirement. And why is that needed? Well, because FDA needs to know who are they going to inspect. Now, of course, that's a little bit ironic, because if somebody doesn't register, then FDA won't inspect them, but that would be illegal, so not a good idea. The other requirement, twice a year, end of June and end of December, we will have to file with the FDA a copy of all of our packaging and also a representative sample of our marketing materials. Well, that can be a lot of information, because you have to upload a bunch of PDFs with all of your marketing materials and packaging changes and so on, but it's doable. Takes some work, but it's not impossible. You have to, however, coordinate the way you collect this information throughout the year, so you basically manage it in the appropriate way to be submitted to the FDA twice a year. At some point in the relatively near future, after the deeming rule is adopted, we will have to provide the FDA with a confidential list of our ingredients, down to the nanogram, down to the single Cas substance. Now, that's again not very difficult for those who make their own liquids. Of course, if you don't, if you buy it off the shelf, well, you better have a good working relationship with your supplier, because you will need that information. So that will have to be filed at a certain time, maybe within 10 months or a year, and there is a template for that. And it's, again, not extremely difficult if you have that information. If you don't have it, you can start working to get it. And you can put, non-disclosure agreements in place, whatever. It's supposed to be confidential. It goes to the FDA. It cannot be disclosed through a Freedom of Information Act because it's proprietary, confidential, and trade secret. And FDA really takes this very seriously. And your ingredient information is safe from your competitors with the FDA. Then, at some point in the future, possibly when testing methods will be developed, we will have to disclose to the FDA what's in our vapor, what's in the emissions, right? But that, in my opinion, is going to take probably a couple of years at least, because again, FDA has to come up with some measurements and with a list of what ingredients, harmful ingredients they're looking for in the vapor, because they won't be the same like in tobacco smoke. And again, remember, tobacco companies already comply to all of these requirements since the last 4 or 5 years. Now, another requirement, almost a negative requirement, it's the requirement to abstain from something, will be to refrain from using descriptors or names that suggest that your product, your e-cigarette, your e-liquid, is less harmful or safer than another product on the market, or that it doesn't contain a particular substance. The latter one is more difficult. The first is clear. You cannot say, my product is safer than cigarettes. I mean, as much as we know it and believe it, but you won't be able to say it. But possibly you may not even be able to say, my product doesn't contain XYZ, because this would be what FDA and what the law calls a modified exposure claim. And in fact, FDA this summer has gone after some tobacco companies that made what they call modified exposure claims just because they said that their product had no additives, which was actually the truth. So the fact that what you're saying is true doesn't matter, because FDA still doesn't want you to say it. Now, there are some provisions in the law that refer to something called adulteration and misbranding. And it's sort of complicated, but basically I would say it in the following simplified way. Thou shalt not have a dead rat in your lab or in your manufacturing facility, and thou shalt not have dirt in your product, and thou shalt not have product that is mislabeled because you put the wrong label on the wrong bottle. I mean, pretty common sense, right? I mean, I wouldn't want to smoke that kind of product either, or to vape it. But FDA, again, as of day one, can inspect you, and they will do a walkthrough through your facility. I've been through 6 of those, and exactly how they go. And of course, they will look at your sanitary conditions, they will look at the way you make your product, the way you maintain your records, the traceability, all of those things. And more importantly, they will also look at the fact that your products are registered, the list of your products is registered with the FDA, because if you haven't told FDA what products you make, those are also adulterated and possibly misbranded, and therefore will be taken off the market. So you sort of have to comply with different sections of the statute. And the holistic compliance with all of them will enable you to continue to be on the market. And each one of them, with the exception of the pre-market requirement, is not impossible. It's costly, but not impossible. You just have to do the groundwork today, because I promise you, if you start when the deeming rule is published, it's way too late. Health warnings. So there is an advance notice of a proposal out there asking about nicotine health warnings. We've seen out of Utah, of all states, some bill that's been introduced, to place health warnings on the product. The fact of the matter is, my personal opinion, with the deeming rule, the health warnings are not going to become effective right away. The reason being the history of litigation with the FDA on health warnings, with the tobacco companies. Basically, whatever is on the warnings has to be scientifically accurate. If not, they're going to be sued and they're going to lose the lawsuit. So, my expectation is the health warning requirement is going to maybe have a two-step approach, or anyways, it's going to be a little bit delayed. But they will be required eventually. Sales to 18 plus. I mean, anybody of you thinks that we should sell to anybody under 18? Because I think that would be, I think that's the easiest to comply with. And by the way, that is something that it's mainly inspected at retail level. So it's less of an issue for manufacturers. The current draft also bans free product sampling, vending machines restricted, but those again are things that you can comply with. They're inconvenient, but you can comply with, and it sort of doesn't cost you any money to comply with. Well, now the most difficult part of the rule is the fact that FDA will require some form of pre-market review and authorization of your product, and I will not enter into details, but suffice to say that that kind of application, that kind of filing with the FDA requires extensive scientific research, extensive knowledge of your own product, extensive knowledge of products you may compare your product with. It requires, in my experience, the simplest ones are, a few thousand pages worth of information. And I leave it at that. And that is something that actually is the most onerous, and it's unique. No country in the world requires even cigarettes, let alone electronic cigarettes, to have a pre-market approval of their products. In the EU, as of next year, in the European Union, there will be a pre-market notification, but it's not an approval. You file your notification, and that's it. If it's complete, nobody honestly probably will review it. Whereas here, FDA actually will have to approve whatever you submit. And there are timelines and so on, but that's too much detail for today. All I want you to think of is you really have to look out to those experts that actually know how to do that, and you'll need scientists and you'll need lawyers, because it is not an easy thing to do. Not impossible, again, can be done, has been done for much more dangerous products, which are cigarette products. Therefore, FDA, when the right evidence and the right information is put in front of them, when you have made your case from a scientific point of view, will approve your product. Again, been there, done that. But if you don't give them what they're asking for, and if your submission is not comprehensive, you honestly don't have a basis to even expect your product to be approved, because you have to persuade FDA that your product basically is made in a certain way and contains certain ingredients. Now, again, a lot of questions. I tried to think up some questions. I'm so sorry. I tried to think up some questions. I don't know how we got to the beginning, but here we are. I tried to think up some questions for you that you may be interested to find out the answer to. And those questions really obviously are based on my experience of interacting with the FDA. So again, we addressed that. Do we know at present what the deeming rule will say? Pretty much yes. It's going to deem our products tobacco products, and therefore please look at the Tobacco Control Act, which has been there for about 6 years now. We know what we have to do. What will happen the next day after the rule is adopted? And the short answer is the next day nothing will happen. We'll wake up and it'll be just another day. But within a few months or a few weeks, depending on the various deadlines in that rule, we will have to start complying with existing provisions of the Tobacco Control Act. So go read it. Now, how much longer can I sell my products after the deeming rule if I cannot meet FDA requirements? And the short answer to that is you shouldn't try, because that would be illegal. But the other answer is until such time that the FDA figures out that your products are legal and are not complying with the various requirements. And I don't know how long that could be. It could be until the first inspection, and the most likely is until one of your competitors or somebody else will tell on you, So I wouldn't count on that, let me put it like that. And again, that would be illegal. Will FDA inspect me? Both manufacturers, importers, and retailers. The short answer is a loud yes. Are those inspections terrible? Well, they are if you're working in an insanitary environment, if you're not having records and processes and procedures in place, if you're not having employees that are trained. Yes, it is a difficult thing to accomplish. Is it feasible? Of course it is. I mean, you can be inspected successfully. But again, my advice to you is to look at the way FDA inspects other regulated industries. The food industry, the tobacco industry, the pharma industry, because that's pretty much what they're looking for, even absent good manufacturing practices or codified good manufacturing practices. That's what they're looking for. Basically, the inspectors they send are food inspectors. They come to the facility and they look for the things that they basically were inspecting in food facilities. How often do you clean your floors? Where are your training records, your machine records? If you change something, what have you changed? Have you done your filings with the FDA? Show me a copy, show me your marketing materials. Prove to me that you filed what you had to file by the deadline when you had to do it. So if you maintain good records, it shouldn't be a problem. If you have a clean facility with traceability, with a good process flow that is well documented, again, it's feasible, but that takes a lot of investment and a lot of planning. And some will be able to comply and some not. Will FDA ban flavors? This is my favorite question of them all, and everybody asks that all the time. And the short answer is, with a dimming rule, right away it will not, because FDA has to engage in a separate rulemaking under a different section in the statute that has to do with product standards to ban flavors. And in my humble opinion, that will take a long time. Now, what FDA can do is when they review those applications I was mentioning, the pre-market approvals, and when they see the list of ingredients, they can raise concerns about those ingredients, whether it's acetate or something else, and they can actually take your product off the market based on those ingredients without technically banning flavors. So FDA does have some other tools to deal with concerning ingredients or concerning flavors perhaps, but not just so easily, not through rulemaking. They have to do a notice and a comment to ban any particular flavor. Just to give you an example, flavors are currently banned for conventional cigarettes other than menthol. But even menthol, FDA is nowhere near banning menthol in conventional cigarettes because of a number of reasons. Lawsuits, the inability truly to find the science that menthol is bad for you. So it's sort of indicative of the fact that flavors are here to stay at least for a while. Now, responsibly marketing flavors, that's a different story. If you market to kids, if you're appealing to kids in a way that is blatant, it's really not good for the industry. You may think you're selling a few SKUs, but it's really not good for the industry as a whole. But flavors are here to stay for now. And again, be on the lookout for additional rulemaking from the FDA, and that will take time. Can we still advertise under the new rule? The short answer is yes. The draft proposed rule did not deal with advertising, and I believe, strongly believe that advertising is going to be available for a long period of time. Again, responsible advertising is something we all have to look, within our own organizations and decide what path we want to take. And again, one of the reasons I'm at NicoPure is that when we were talking and when I was basically, engaging with them in view of joining the company, I was convinced that they were going to do the right thing and that they were, while aggressive, they were going to do the right thing in terms of responsible manufacturing and advertising. And therefore, we are basically, we have our own internal marketing rules and so on. And I urge all of you to consider adopting internal written marketing rules that you stick to and adhere to, and that actually demonstrate to the outside world that you're responsible manufacturer and advertiser. And what about taxation? Well, the short answer is FDA does not deal with taxation. FDA, dimming rule, or anything that comes out of the FDA does not impose any taxes. Taxes are creeping up at state level. That's another battle for somebody else out there, not for us here. But basically what happens is the FDA does not deal with taxation. FDA also does not deal with clean air laws, with vaping bans. So, you will not see that coming out of the federal law. That's going to be at state and local level. What can we do collectively next? Well, again, watch the Office of Management and Budget website. That's going to tell you when the dimming rule is imminent. Engage through trade associations or even directly with the OMB to discuss what impact from an economic point of view, how much it's going to cost you to comply with FDA's dimming rule. And it's going to cost a lot. I mean, people have quantified it to, to the tune of many, many millions, possibly. You will need expert advice on FDA regulation. And of course, that's very self-serving, but I also can tell you that it's absolutely true. Even we get help from additional lawyers, in addition to myself, to have the complete picture of how, how to deal with this very complex piece of regulation. And engage with the FDA. Go to FDA free webinars, attend free workshops. They're all free. You have to sign up the moment they're announced. And engage. There is a public comments period at every FDA workshop. Take advantage. You have 3 minutes to sign up, and you tell your story. Now, FDA has heard a million times how smokers have quit because of vaping, and that's a good story to hear. But what they really want to hear is, how can they regulate in a way that is sensible yet constructive for the industry? So I think those are the kind of comments that you have to constructively think of. But definitely, it's a good way to engage. And you can ask for meetings. FDA prefers to meet with groups of companies or trade associations in the interest of time, because if they had to meet with 3,000 people, they wouldn't be doing anything else. But that's something that I think you can and should do. Now, I know I formulated my own questions, but if you have your own questions, I'd be more than happy to answer as much as I can. Bear in mind that nothing I've said here is legal advice to any of you. Feel free to, talk to lawyers who are going to tell you something else. Although I'm pretty sure they'll tell you pretty much the same thing. But I'd be very happy to answer any questions, and thank you very much for your kindness and patience and for being here. So. Please. Oh, excellent. That's a wonderful question. So the question was, in terms of meeting with the FDA, how do you go about setting up a meeting? And the short answer is, there is a resource, but the best way is to write the Center for Tobacco Products, which will be the center or the department within the FDA. If you look up under fda.gov, there are different tabs on their website, and there is a tab called Tobacco Product. And you have to navigate a little bit. There is an email address, which I believe it's askctp@fda.gov. But I wouldn't want to misquote that. Basically, you send an email, but the better thing is to write a letter, and I would address that letter actually to depending on what your meeting is about, I would address it to either Mitch Zeller, who's the director of the Center for Tobacco Products, Zeller, Z-E-L-L-E-R, or to even Dr. David Ashley, A-S-H-L-E-Y. He is the director of the Office of Science, in particular if you're a question or your comment. And so write them a letter, and basically FDA wants, before having a meeting, they want to know why you want to meet with them, who do you represent, what's your question, and as much information about yourself as a company, but also more importantly, what do you want to accomplish from the meeting. And the letter is usually a good thing. And they do answer, I would send it by email and also by regular mail. They do answer, and actually they do take meetings. I know the lead time sometimes is long. The more concrete and specific your meeting request, the more likely it is you're going to get the meeting soon. If you tell them would like to meet with you and discuss electronic cigarettes, I'm afraid that won't cut it. But if you want to tell them, we have the following data, we have data about the economic impact of this rule, and this is what this rule has to my business, or we have new research or something like that. All of that, again, put that in the letter, and then again, they'll get back to you. They'll give you a few dates that are convenient to them. My experience, I think they were meeting with the industry mostly on Thursdays, but it doesn't matter. They may have changed the day, yes. Yes, ma'am. No. The meetings are always at the FDA site, which is currently, it's the White Oak campus. It's in a suburb of DC. And, they'll tell you the time, date, and you go there, you have to have your ID, log in, and so on, but they don't meet outside of that. But a good way to meet with the FDA without really going through this process is to attend all of FDA's Tobacco Product Scientific Advisory Committee meetings or free workshops. And if you go to the website of the FDA under tobacco products, I think there is a section there called upcoming events, or maybe this week in CTP. CTP is an abbreviation for the Center for Tobacco Products, and that section would tell you if there is an upcoming workshop. So for instance, I know there is a workshop in November, I think it's on the 5th of November. It's a very important topic, so I personally won't attend it. It's about statistics. But because, and I think the sign up was a while back because they have some limited space, but these kind of events is where you can go and actually see what they look like, and also by watching these kind of workshops, you can also understand where FDA comes from, because they're people just like us, you know, but then they're doing their job. I mean, they may not necessarily like a particular product, but they're limited by what their job tells them to do. So when you attend their meetings and you hear their questions, you understand they come to this from a vastly different place, vastly different. It's almost like, you know, a parent and a teenager, where the teenager comes from, oh, I want to enjoy life and have fun, and the parent comes from his experience and from his other criteria, which is, I want my child not to be harmed. So, you know, it's not a matter of competing interests there. It's a matter of, again, the angle that you look at the same issue. So, any other questions, please? Thank you for the question, very helpful. Thank you. Have a nice day. Thank you.